to the Medicare meeting. This is an educational Medicare meeting. My name is Kathy Hurwitz-Millen, and throughout this meeting, any questions you have, anything you want to ask me, please do so, because I know that, as this slide shows, it's very confusing sometimes to people, and things are changing ever presently. You know, things of this year, 2025, the biggest changes that are occurring in the history. So we're going to just go over a little bit of that. And also, I just wanted to give you a little bit of my background. I had been in insurance for several years. I used to travel quite a bit. I worked with the Chubb Company. And I would go and I would train people to go into corporations and do supplemental benefits to enroll people. And then when I was approaching the age of 60, I would start to talk to people that, you know, my people that I worked with, coworkers, and I'd say to them, do you understand anything about Medicare? And everybody was, these are people, you know, professional insurance people, like, no, it's so confusing. So that's when I decided that I wanted to do this. I wanted to be able to explain Medicare to people. Okay, so that's a little bit about me. I live in East Longmeadow with my husband, and I am contracted with 36 carriers. So in other words, there's never any cost for me to come out and explain some of the insurance benefits to you regarding Medicare. I specialize in Medicare. The companies compensate me when I help people enroll. And as I say, I'm appointed with 36 companies. And the nice thing is every year you have to be reappointed, like with annually. And it's a good thing that they're very strict about it. Even like this meeting, it has to be all educational. It doesn't, you're not supposed to, and I don't, you can't mention any different companies, or you can't talk about individual issues because of HIPAA laws. And, you know, it's a good thing. You know, they regulate it very carefully so that seniors can really understand the process, as well as, you know, the Medicare itself, because once again, it is really very confusing. So what I'm going to talk about now is Part A and Part B, okay? So Part A, when you turn 65, and some of you already know this, that if you collect Social Security, then they'll send you Part A and B. You don't have to sign up. They automatically sign you up. But if you don't, if you're still working, you have the option to sign up for Part A, which is generally free. And you can sign up for Part B, or you can stay on your company insurance. Okay? There's no penalty as long as you have insurance, creditable insurance, which means it's just as good as Medicare. So sometimes people get very nervous and they say, oh, you know, am I going to get penalized because I'm still working? No. As long as you have creditable coverage, you don't have to worry at all. And of course, you have to have worked 10 years or 40 quarters in order to be able to sign up for Part A and Part B. And then, or have different conditions, Lou Gehrig's disease or chronic renal disease. And then you could sign up for Medicare. Now, there's different enrollment periods. So right now we're in the open enrollment period, which is October 15th to December 7th. So that's when I'm like the busiest ever. Like, you know, like I have, you know, several clients, and each year, most of them, you know, East Longmeadow, Springfield, Chicopee, Ludlow, you know, surrounding areas. I don't go too far because I'm busy enough with, you know, with this area. But I call people every year and I say to them, you know, are you happy with your plan? And if you're not, during, most of the people, I want to say like 85% of the people are pretty happy. If not, though, if something happens, a change in your life, or then we can switch you. We can switch you to a different plan. Often I'll call people up and I'll say, are you happy with your plan? And they'll say yes. And then I'll say, have you used your benefits? And they'll say, what benefits? And I'll say, like the over-the-counter medication, because some of the plans offer that. And they'll say, oh, no, I didn't even know I had it. And then I tell them about it, and they go right out and they use it. Like there's some plans that include over-the-counter medication. And I mean, it's a good thing to have different things that I just like to just remind people about, because often you have benefits and you don't realize some of the benefits you do have. So as I mentioned, Medicare Part A, okay, that's hospital. That's inpatient hospital care, skilled nursing care, general nursing, hospice, blood, and miscellaneous service and supplies. So that's, when you sign up for Part A, that's what Part A is. And Medicare pays 80%, okay, for Part A and Part B. Okay, this is that's Medicare Part A. That's if you should go into the hospital and you don't have any additional coverage. Your deductible would be $1,632. Okay, that's for the first 60 days. Now, this is just telling you that Medicare pays 80%. Okay, now what happens to the remainder 20%? So that's why some people enroll in a Medicare Advantage or a supplement plan. Because just think of it, say you go into the hospital, and it's not so unusual to come out of the hospital with a $100,000 bill. That's not really unusual. So what about the 20%? That's $20,000. I mean, most of us can't afford that. So that's why people, in addition to your Medicare Part A and Part B, either enroll in a Medicare Advantage or a Medicare supplement plan. Okay, any questions regarding that? Okay. Okay. Let me just scroll to this part now. Okay, so Medicare Part A will only pay for skilled care in a Medicare-approved nursing facility. And then if you don't have an additional coverage, Medicare pays for the first 20 days, for example. But after that, beginning the 21st day and for the next 79 days, you would have to pay $200 per day, with Medicare paying the rest. And then after 100 days, Medicare pays nothing at all. So as you can see, that's where all of the other plans will pick up. Okay? So that was Medicare Part A, and generally it's free. Okay, so even if people are working, people like to sign up for Medicare Part A because they can have their work insurance, and then Medicare will be secondary if the company has 100 or more employees. Now, with Medicare Part B, okay, they'll pay for such things as doctor services, lab work, outpatient hospital services, medical supplies, and the current deductible, this is as of 2024, it's $240, okay? That would be the deductible on Part B. And once again, Medicare pays 80% of the approved amount. And if you've noticed, the Medicare Part B does cost. Sometimes they'll take it out of your Social Security. It's $174.70 per month for most people. Okay, and this is where people get confused because Part B, people don't think initially that Part B costs anything at all, but it does, okay? However, it goes on a sliding scale. So in other words, and you can see on the right side of that chart, if you earn $0 to $103,000, that's single, or married to 206, it'll be $174.70. Now, if you earn more, the cost is going to go up. But also, if you earn less, if you're under $29,000, approximately $29,000 now in Massachusetts, you can apply for, it's called extra help, and the state will pay that for you. You'd apply, and a lot of people don't know about that, and I do help people, to sign up, and there's a lot of people that once they retire, their income goes way down. So at that point, they really shouldn't be paying for their Part B. They should be filling out the application. And not only does extra help you with the Part B, it also helps you with the prescription coverage. And I'm going to show you a little bit of the prescription coverage, but it will help you with prescription coverage. It'll help you with a lot of the extra costs that you may have. And even if you feel like you don't fall into that range, if you don't make under the $29,000, you can still apply, and then, because there's 3 different levels, they may be able to say, well, you don't qualify for the fully eligible, but maybe you're partially eligible, and you'll qualify for maybe half of the Part B. So it's if you think you're within that range, it does help to it would be helpful for you to apply. Any questions regarding that? Uh-oh.
Yeah, it's a little confusing up there.
Sure.
Up there where it says income-related monthly, we'll say in a second one, if you're making between 103, 125,000,
Yeah.
the total cost is 244.
60.
How do you end up with 69.8?
Where do you see 69.90?
Under income-related monthly adjusted amount, second line. 69 was 80.
That's the additional amount you would pay to the 174.70. See, they're adding it. That's the additional amount.
I see what you're
Yeah.
saying.
Yeah.
To get to 244.
Right.
Oh, I'm sorry.
That's called that's okay.
I didn't
These charts
understand
are,
the chart.
No, I know. You're paying additional to what somebody, you know, who's making would pay. You could pay up to $419.30 more than, you know, the average person. But on the other end of the spectrum, if you make less, you're going to apply for extra help. And so it's really very much income related. Okay? Okay, so Part B. So as we mentioned, so once you sign up for Part A and Part B, okay, you have two different options, okay? The first option is you can purchase a supplement plan, and you can also, if you purchase a supplement plan, good morning. Here you go. Sure, here you go. There you go. And if you purchased a supplement plan, you also would need to purchase Medicare Part D, which is prescription coverage. And if you wanted to add anything else additional on, like dental, vision, you would also be adding that on. So that's one option you have. And several of the carriers in your area have supplement policies. The average cost is about $165 a month for the supplement policies. And then the prescription cost, I have found the average is about $30 for the prescription coverage, just to give you an idea of the cost. Or the second option that you have is to enroll in a Medicare Advantage plan. Okay, and they're very popular. A Medicare Advantage plan, it combines Part A and Part B. Okay, so it covers that 20% of your medical and the doctors and the labs. And then it also has additional benefits, and it includes dental and vision, hearing. Most of the plans cover prescription drugs, so it includes everything pretty much. Some of the plans, like I was mentioning earlier, they have over-the-counter coverage. So in other words, they give you, right now, on my plan, I'm getting $100 each quarter, every 3 months, and I can go over to a CVS and purchase for free. I get $100 that I can use. And I go into the store and I look on the aisles, and they should have a little blue sticker. And if it does, that means that that product is eligible for over-the-counter coverage. And that's when, like, I call my clients and I'll say to them, you know, have you used your over-the-counter coverage? And they'll say, oh, I forgot about it. And you know yourself, like, you could go into a CVS and you come out and it's like, oh my gosh, I spent, you know, $100 and I don't know what I even bought, because, you know, whether it be cough medicine. So a lot of these products that they include, there's vitamins included, there's cough medicine, I even got a little electric toothbrush from it, because they toothbrushes and toothpaste. So it's not, they're all things that you'll use. They're medical related. I had a back issue a while ago, and I got like a back brace. So, you know, they're all things that you would use. So that's a good additional benefit to have. So does everybody understand the difference? Oh, and what I did want to mention, so Medicare supplement, if you enroll in a Medicare supplement plan, you can go to any doctor that accepts Medicare will accept the Medicare supplement plan, okay? And you pretty much, other than $240 deductible, you go into the hospital and they'll cover everything. They cover the copays, they cover the deductibles. Whereas with the Medicare Advantage But there is a premium you'll pay each month for the first option, for the Medicare supplement. You'll pay a premium, but you're pretty much covered for all of those additional costs. Whereas with the Medicare Advantage plan, there usually is no cost to it. But when you enroll in the plan, they want you to stay in network, okay? They want you to stay in network, and there's some limitations. Although, like the larger carriers, they have networks throughout the country, okay? So any questions regarding that? Does anybody in here have a Medicare Advantage plan? You do? Are you happy with it?
So far.
Okay, good, good. You know, so that's option 2 there. And it includes the dental, the vision, and everything for you?
It doesn't include dental.
It doesn't include the dental, okay.
Yes, it does.
It does, okay.
Recently it was added, I think, a year or so.
Okay, they added it in, yeah. And each year it changes, you know. Each year, each company will change it a little bit. That's why I say, like with my clients, I'll call them up every year and say, you know, and just sit down and say, are you happy with your plan? If not, I don't, you know, I do get certified and I know all the plans, but like there's so many different details. I put your information into a computer. It's called Medicare Center, and like whether it be the doctors you have, whether it be the specialists you have, whether it be the prescriptions. I put everything in here, and the computer comes out with like different options, the best options, the most economical in your area. So you know, that's a good thing to consider annually. So right here, we mentioned the first option, the Medicare supplement plan. So this is just showing you basically some of the different plans that they have. So that's why sometimes people feel it's confusing, but there's so many different Medicare supplement plans that you want to, and it's priced accordingly as well. So you want to make sure that, for example, one of the best plans, which was Plan F, as you can see, it covers pretty much everything, preventative care, everything down the line. And that would be a little bit more expensive, but you'll have that coverage across the board. So these are the different plans that you may want to look at and consider. Let me see here. Okay, and so as far as the Medicare Savings Program, which we mentioned a little bit earlier, these plans are called a Dual Special Needs Program plan. So if you think that you fall under the threshold, and right now it's if you're married and you earn less than $27,465, and each year it goes up because of inflation. If you think that you earn, and when I say earn, that's after adjusted income, okay, gross adjusted income. So you might think, oh no, I earn more than that, but it's on line 11 on your income tax return. That's how I like to tell people, because it gets confusing, the adjusted income, but if you know, if you check in line 11, and if it's less than that, you definitely should apply for the extra help program. And as you can see up there, there's 4 different categories. So you can have the qualified Medicaid beneficiary. That's the very highest level. That means you're fully eligible. And then there's different other categories. There's specified low-income Medicare beneficiary that will help pay for the Part B. Okay, if they approve you for qualifying individual program, then it will be B only, and it will also maybe pay for some of your medication. So it depends on where you fall on the spectrum there, but wherever you fall, if you think you're within that range, it makes sense for you to fill out an application, because it's very helpful. And like I said, as we get older and we retire, sometimes we're earning a lot less money than when we're in the workforce, right? So, so basically that is it. Does anyone have any questions regarding that? Oh, sorry. Any questions at all? No? Okay. So basically that's the end of the presentation. And there's also, I didn't mention, there's also programs for vets. So if anybody in here, is anybody in here a vet? No? Okay. So, but sometimes if you know somebody who is a vet, there's certain programs that they get a few extra benefits. It actually incorporates like the Soldier's Home into a program that you have with a Medicare plan, whether it be an Advantage plan or a supplement plan. So the vets, can get different types of benefits that you wouldn't normally have. Okay?
I have a question.
Sure.
How much was that Medicare Advantage plan where they covered everything? Do you have a ballpark figure?
Sure. So I'm just going to pull that up. Okay. So I think you're talking about option 1. The Medicare supplement plan is the one that covers everything. A ballpark figure. So with the Medicare supplement plan in your area, most of the larger carriers, I want to say it's about $165 to $170 for 2024. Okay, and then you add you need prescription coverage, Part D.
Yes.
Okay, so that's about $30. So that's a couple of hundred right there.
Yes.
Okay,
Yeah.
in addition to your $174.70 that you pay for your Part B,
Right.
and then if you want any dental, if you want any vision, you add that on.
So all that is separate.
That's all separate.
Okay.
So like the advantage of that is, you don't have to worry about anything. Should you go to the hospital, should you go to the doctors, no copays, no deductibles. However, I'll give you an example because I am on a Medicare Advantage plan right now. I really like it. When I turned 65, I thought to myself, now which one do I want? And I thought to myself, well, Medicare Advantage, it doesn't have any monthly payment, and it includes the prescription coverage of the additional benefits. And then I looked for a company that has networks all over the country because I go down to South Carolina sometimes. So I wanted to make sure if I'm down there, I can find a provider in network. So I went with a larger carrier. So I mentioned I play pickleball, right? But I had a back injury. And I wasn't able to actually walk for almost 8 months, and I couldn't play pickleball, which is the worst thing of all, right? So I started off, and I was on the plan. I started off, and I went to physical therapy, and I said, no, I'm not getting any surgery. Physical therapy, and then I tried a chiropractor. I tried the injections. I tried everything. And then after like 7 months of not being able to walk and really bad pain, I went over to the Hartford Bone and Joint, and they told me I needed surgery. I could get outpatient surgery, and I loved the way they were over there. They were just so good, and I thought outpatient surgery. So I made an appointment. I went in. I got outpatient surgery. It took about 2 hours. I walked away, and oh my gosh, I've been playing pickleball, and I've been good ever since. And I'm so pleased. Now, so the Medicare Advantage plan that I had, I figured like, oh my gosh, am I going to have a lot of deductibles and copays? Well, the cost of the surgery was over $37,000, even just for the 2 hours. I ended up paying $365. That's all I paid. So it was great. It was great. So from my perspective, that worked very well for me. One thing I did want to mention, that we live in a guaranteed issue state. So in some states, you can only qualify for a Medicare supplement plan. Once you turn 65, you have 6 months to qualify. After that, if you have any health issues, or they will put you through underwriting, and they can refuse you, the carrier. But in our state, it's guaranteed issue. So you can switch from a Medicare Advantage plan to a supplement plan if you want. So I really like that because I realized, like, okay, as I get older, if something happens, and I really feel I need a supplement plan, no underwriting. I can, during open enrollment, I can apply for the plan and I can switch over. So that's what made me choose the Medicare Advantage plan right now. But it's all on an individual basis. Whatever you're comfortable with, whatever you think, whatever you feel. There are some people who I go to see, and they have specialist appointment. They have a cardiologist and a foot doctor, and they might go to 3 or 4 doctors, specialists during the month. So they would have a copay. So it probably makes sense for them to go with a Medicare supplement plan because that's all included. There's no copays. So it really depends on where you are as far as which choice you want to make, but it's nice to know that you have these choices. And it really isn't as complicated as you may think. What I think that confuses people is during open enrollment and other times, a lot of the carriers, they send lots of literature. Like probably all of you know now, everybody probably has something from some company, right, saying like sign up now, you know, and some of the wording is a little bit alarming, like urgent, you know, sign up now. Well, you're already signed up. For example, I have a client who enrolled in a plan earlier this year, and then she got this this notice, and she called me up and she said, Kathy, I am so like upset. And I said, why? She said, because they told me to sign up. I thought you already signed me up. And I said, oh, of course I did. I said, but she didn't realize that it was just mass mailing, you know, that you know, you get these from all these different companies. And then some of the companies will say, well, you may qualify for like extra food. Some of the plans have food, like healthy food on it. That's if you qualify for the DSNP plan and you're under the limit. So you really have to know, you know, where you fall on the spectrum, and you know, and that's where like I like to help people to figure that out sometimes, you know. So yeah, it's a little bit daunting at times, but it's, you know, it is a good program. I mean, we work all our lives, right? And every week you see that money coming out from Medicare, right? So finally, when you turn 65, you know, you get benefits. Unfortunately, people are very surprised when we say, yes, Part B does cost, you know, a premium. They don't realize that. That's the biggest surprise that I find people have.
Well, now we're bombarded by the mailing and TV with all this Medicare information. So, you know, it's hard for people to choose.
It really is. Like some of the, Joe Namath was on one of the TV. He was like a baseball star, and after that ad came on, I was getting calls saying, "Well, why aren't I getting healthy food?" And why Joe Namath says, and I'm laughing to myself and saying, "Well, no, like we'll look at your situation, but you know, if you don't qualify for it, Joe Namath isn't going to help you." Oh my gosh, yeah. But so everybody have some snacks, have some cookies, and if you'd like any questions at all, just let me know, okay?
Thank you
Thank you
very
for coming. Thank you. Thank you so much.